Why are some UTIs so hard to eradicate? Imagine battling an infection that just keeps coming back no matter what you do. Some urinary tract infections are exactly like that, and understanding why can help you see the bigger picture of bladder health. UTIs are caused mainly by bacteria like Escherichia coli, which normally live in the gut but can invade the urinary tract. Usually, antibiotics clear these infections quickly, but sometimes they don't. One big reason is antibiotic resistance. Over time, bacteria can change and become resistant to the medicines designed to kill them. This resistance develops mainly because of overuse or misuse of antibiotics, making some bacteria harder to eliminate. When bacteria resist antibiotics, doctors might need to prescribe stronger drugs or different types, which can take longer and sometimes requiring intravenous treatment. Another challenge comes from complicated UTIs. These happen in people with certain risk factors, like having a urinary catheter, kidney stones, an enlarged prostate, or a weakened immune system. These situations often involve a wider variety of bacteria, including those that from biofilms. Biofilms are protective layers that bacteria create, making it difficult for antibiotics to reach and kill them. These biofilms often develop on foreign objects like catheters or stones, shielding bacteria from both medication and the immune system. Because of this, infections become more persistent and harder to treat. Recurrent UTIs are also common, especially in people with bladder conditions or a history of bladder cancer. Factors like incomplete bladder emptying, blockages, or changes in bladder structure after surgery can make it easier for bacteria to hide and cause repeated infections. Sometimes, even after treatment, bacteria remains in the bladder, leading to ongoing symptoms or frequent flare-ups. Other factors that can make UTIs tough to eradicate include low fluid intake, which reduces the body's ability to flush bacteria out of the bladder. Constipation can increase pressure on the bladder and interfere with proper emptying, creating a perfect environment for bacteria to thrive. Certain birth control methods, like diaphragms or spermicides, can also alter the normal bacteria balance in the genital area, increasing infection risk. Recent urinary procedures or surgeries can introduce bacteria into the urinary tract, making infections more difficult to clear. From a bladder health perspective, persistent UTIs can sometimes mimic symptoms of bladder cancer, like frequent urination, pain, or blood in the urine. This overlap makes accurate diagnosis crucial. For individuals with a history of bladder cancer or bladder surgery, the risk of complicated or recurrent UTIs is higher because of changes in bladder structure or function. In summary, some UTIs are hard to eradicate because of bacteria developing resistance to antibiotics, the presence of biofilms, underlying health issues, and factors affecting bladder health. For those with bladder conditions or a history of bladder cancer, these challenges become even more significant. It's always best to work closely with healthcare providers to get proper diagnosis and tailored treatment plans. Remember, managing UTIs effectively depends on understanding these factors and seeking professional advice to protect your bladder health.